It's my pleasure to welcome Professor Ian Kessler to the interview about HRM special issue, Sustainable Work and Employment in Social Care, New Challenges, New Priorities. Ian is professor at King's College London, UK, and has written an editorial paper that frames the articles in this special issue. Ian's co-authors were Aoife McDermott, professor at Aston University, UK, and fellow at University of California, US. Landa Vermeerbergen, associate professor at Radboud University, Netherlands. Valeria Pulignano, professor at the University of Leuven, Belgium. And Brian Harney, professor at Dublin City University, Ireland. Ian, welcome to the interview with HRM, with me.
Thank you.
Why is this special issue about HRM in social care important? What is the problem that led you to create a call for this special issue?
There are a number of reasons for the special issue. One is around kind of general social and economic trends. So there's an increasing demand for social care amongst populations across the world, partly related to aging populations, the development of chronic conditions. And this is taking place in the context of shortages in social care workers. So we've got a huge demand in the need for social care at the same time as there's a growing shortage of social care workers. Secondly, this is an area which employs a very significant proportion of the workforce in many countries. So social care, which is sometimes called long-term care in countries like the US and parts of Europe, comprises a huge segment of the working population. So in the European Union, for example, there are 3.1 million social care workers. If you add the UK, which has 1.6 million social care workers, you're almost up to 5 million social care workers. In the US, there are something like 8 million social care workers or workers in long-term care. So this is a very sizable proportion of the workforce. And yet, while being a sizable proportion of the workforce, it is relatively neglected within the HRM literature. So it's surprising, given the size of this workforce segment, that there's very little research conducted on social care workers and human resource management in the social care sector. So, for example, just going through the mainstream HRM journals, including human resource management, you will find very, very few articles dedicated to HRM in social care. So one of the reasons, or one of the elements of our editorial is actually trying to explain why there's been such limited research on social care workforce and HRM in the social care sector. And we highlighted a number of possible reasons for this relative neglect. First, it's quite difficult to actually scope the social care sector in terms of the kinds of services that it's provided. So with healthcare, for example, it's quite easy and straightforward to say that healthcare sector is dealing with a number of clinically specific diagnosed conditions. Social care is slightly more amorphous in terms of what kind of services it provides. So principally, social care is providing support to people in the community with daily activities of living, getting up, getting washed, getting fed, helping people get about. But it's quite difficult to pin down what kind of services are provided. As a consequence, it's also quite difficult to scope the social care workforce. So the social care workforce is actually quite difficult to locate. And it's also quite a segmented workforce as well. So while you've got core full-time or part-time paid workers, you've also got quite a few voluntary sector workers who contribute. Members of the individual's family and their friends also help in providing care to people in need. So it's quite a difficult workforce to pin down. And finally, it's maybe partly a neglected area of HRM because it's quite a crowded research space. So there are quite a few other fields of study who are interested in social care and the social care workforce. And some of these other fields, for example, social work, public policy, social policy, they have maybe a slightly more privileged and nuanced understanding of the technical aspects and the clinical aspects of social care, which often makes it quite difficult for HRM scholars to kind of venture into that space with their more generic management knowledge. So I think those are the kind of reasons why we felt it was worth going into this space with a special issue.
Your article or editorial paper, it frames 6 articles comprising the special issue, and you also review the relevant literature in the field. So what did you find based on this review and from these articles that are in the special issues?
We basically framed the original call around 3 main themes. So we were interested in looking at, if you like, systems-centered research on the social care sector. So what does workforce management generally look like at the sector or systems level? The second theme was around looking at organization-centered research. So what was going on within the confines of the organization, the social care provider. And the third theme was a kind of stakeholder theme. So what is the research literature telling us about the different stakeholders in the provision of social care? So that would be workers, the state, employers, and also the social care service users, the clients of social care themselves. So those were our 3 main themes that underpinned the call. And we had 6 articles, as you say, which addressed those different themes to differing degrees. So 3 of the articles were very much centered on stakeholders, but particularly one stakeholder, the employee. So we had 3 articles by Mustafa and colleagues, by Zetner and colleagues, and a 3rd article, Kavanagh et al. They were basically looking at the employee perspective, and there was quite a strong interest in how social care workers dealt with pressures and tensions at the workplace. So it's an interesting feature of social care work that the workers themselves face quite a lot of violence and harassment and bullying at the workplace, not least from service users. And it's interesting to explore why social care workers face such bullying and harassment. But those 3 articles were looking at how social care workers dealt with and responded to those workplace pressures. So one of those articles, the article by Zetner et al., they were looking particularly at role clarity and how role clarity affected the well-being of social care workers, particularly mediated by leadership policies. The Mustafa article was also interested in worker resilience in the face of harassment from service users, and again how that was moderated by leadership policies and practices. And the Kavanagh article was also interested in how organisations dealt with the harassment and bullying faced by workers, and they were looking at the kind of management approach to dealing with that harassment and what that told us about the ethics of the service provider. So we had 3 articles focused on one particular stakeholder, the employee, and particularly on how the employee coped with harassment and bullying at work. These were principally quantitative studies looking at the relationship between different variables, harassment and bullying faced, leadership policies, and certain outcomes in terms of resilience and well-being of the workers. We then had 3 other studies which were much more organisation centred, with some sensitivity to the systems level. So we had a study that was undertaken by Curry and colleagues, and they were basically looking at how organizations, social care providers were using high performance work practices to support the introduction of a particular policy area in social care, which is called the strength-based approach to social care provision. And they were looking at high performance management practices as applied and used for social workers, which is a professional group of care workers, and how compatible those high performance work policies were with certain social worker professional values and beliefs. We had another study that was carried out by Belloc and colleagues, which was a case study of a social care provider looking at their recruitment strategies in terms of recruiting staff that could deliver person-centered care to their clients. This organisation had faced major problems recruiting workers with the capabilities and the capacities to develop and deliver person-centered care. And they looked at the development of a new kind of in-house recruitment service, which enabled them to recruit those types of workers. And then finally, we had a study which was much more system-centered, actually, which was looking at the sustainability of certain HR policies and practices as used and applied in the social care sector. This was by Hughes and Dundon, and they looked at patterns of employment, they looked at employee voice, they looked at pay levels and how sustainable those practices were and what evidence there was to support the use of those practices in delivering high quality social care. So those were the kind of 6 articles that comprised the special issue. And our review of the literature very much used those themes: systems level or system-centered literature, organization-centered literature, and stakeholder-centered literature to review the literature itself, the wider literature in HRM. I mean, we started in the editorial with the organization-centered literature because I think it's fair to say that HRM as a field of study has tended to concentrate principally on the organization and how the organization manages the workforce, the policies and practices that the organization adopts. And we didn't find, as I say, a huge amount of literature in mainstream HRM. We drew upon a kind of wider range of literature from public policy, sociology of work and employment, certain women's studies literature, because the social care workforce is highly gendered, is predominantly a female workforce. What we did find is that there was a quite an interesting general pattern in terms of what the empirical evidence was telling us, which is that the treatment of social care workers is pretty poor. In other words, the kind of HR policies and practices applied to the social care workforce are pretty hard. They're based upon cost minimization. There's relatively low pay. There's relatively unstable patterns of employment. There's relatively little employee representation or employee voice. So it was quite interesting to see this pattern apparent not only on a national level but across nations, suggesting that there were maybe certain sectoral features or systems features which led to this convergence in quite a hard approach to the treatment of social care workers. At the same time, we did find evidence to suggest that if social care providers, social care employers did treat their employees in a supportive, developmental way, adopting softer or high commitment HR practices, there was a positive relationship between the use of those practices and certain outcomes, particularly in terms of care quality. So there were a number of studies which looked at the relationship between HR practices and the quality of care that was delivered. And these studies, they weren't actually carried out in mainstream HRM, but in a broader public policy literature. But these studies did tend to show that if employees were treated well in terms of pay, secure employment, greater voice, there were better care quality outcomes. The interesting feature is that very few employers adopt those policies. So the question is, why do so few social care providers adopt the softer approaches? And it's also quite interesting to explore why and how certain employers can adopt those policies and procedures. So we're not saying there's in any sense a kind of deterministic relationship between sector and employer approach. We can see certain predominant patterns around convergence to hard policies, but certain employers can still break out of those constraints and deliver a more softer developmental approach to the treatment of social care workers. So that was the organisation level. The systems level is really looking at features of the social care sector, which may help us account for this convergence around these harder HR policies and practices. And there were a number of features which may account for this particular convergence. So it's interesting to note that in many countries, the social care sector is highly fragmented. It's made up of a large number of often small or medium-sized social care providers who may not have the expertise in HR policy and practice. They may not have the scope to develop the HR infrastructure which is needed to support their workforce. There's an absence in the development and existence of a specialist and well-developed HR function because you have this fragmented social care sector. Another reason at systems level is that the way in which the social care workforce is regulated is often quite weak. In some countries, there are kind of national minimum wages which kind of apply to the social care sector. And in some countries, there are collective agreements which cover the social care sector. But in general, the regulation of the workforce in social care is quite weak. Employers are not constrained by regulations in terms of how they treat their workforce. There's also some issue around the governance of social care provider organisations at systems level, which might also explain this convergence on hard policies and practices. So we are seeing the emergence of private sector organisations who are seeking to drive profit levels and pushing down terms and conditions as a consequence. There are in some countries the emergence of private equity firms with considerable leveraged debt who are actually taking on social care services and clearly driving profits to service their debts with detrimental consequences for the way in which the workforce is treated. And finally, and I suppose at a broader level, and what is quite interesting in terms of the literature we looked at, there have been broader trends in the delivery of public services and in public management, which may help us explain the convergence and harder policies and practices. So, for example, marketisation, the introduction of market forces into the delivery of social care, with the state withdrawing from the provision of those services, often commissioning those services from the private sector, also produces a downward pressure on terms and conditions. So if you're commissioning for social care services, those organisations tendering for the services obviously want to keep their costs down to win the tender. Social care is a predominantly labour-intensive sector, so how do you keep costs down to win a contract where you reduce terms and conditions of employment? So there are a number of kind of, if you like, systems level pressures which we found. And finally, when we looked at the stakeholder literature, I mean, I suppose the stakeholder literature covers employers, which we looked at particularly when we looked at organisations, but employees, service users, and the role of the state. I think what is quite interesting is there's been quite a large amount of research on social care workers themselves, but it hasn't really got into the mainstream HRM literature to a considerable extent. So the thing about the social care employee, as I said, they tend to be gendered. They tend to be women. They don't tend, but there's a significant proportion of people with black and minority ethnic backgrounds. There's quite a significant proportion in certain countries of migrant workers who actually perform these kind of roles. And I think there's been generally limited research on the experience of social care workers characterized by gender, ethnicity, and migrant status. So we looked at that literature. Even more absent is research on social care service users, and the relationship between them and the social care workers is very, very close. And there's very little research which has looked at the workforce from the perspective of the social care user. In public management, there's quite a strong literature on co-production, which is about how service users are involved in providing and designing services, and that's very important in social care. Relatively little literature on the role of service users in terms of how they affect the HRM agenda in social care. In terms, finally, of the state, I think there's also considerable scope for more research on how the state impacts and regulates the social care workforce. So there's relatively little evidence on how, for example, broader public service delivery models impact social care. So there is quite a lot of literature in public management on different service delivery models, but very little attempt in the HRM literature to marry that public management literature to the HRM literature to see how different models of service delivery impact the workforce. And I think what is quite interesting in that respect is the emergence of more networked forms of service delivery now that are emerging, and kind of integrated care systems, bringing health and social care together with very significant implications for the way in which the workforce is managed. Relatively little discussion about integrated care systems and their impact upon the workforce. There is in the public management literature, but there's not much in the HRM literature on these kind of systems, these integrated systems models, which raise some very interesting questions for workforce management.
Why do the findings reported in this special issue matter theoretically?
There are a number of possible theoretical contributions. I mean, I think, firstly, from the organizational perspective, I think that the mainstream HRM literature had, particularly strategic human resource management literature, has clearly looked at the relationship between HR policy and practices, employee attitudes and behaviors, and organizational outcomes, mainly defined in corporate terms. So the kind of dependent outcome metrics have tended to revolve around financial measures, profitability, value added, the competitiveness in a kind of profitability sense of organizations. In social care, we're dealing with very different outcomes, very different dependent outcomes. These are outcomes that are related to the most vulnerable and fragile members of the community. So we're looking at outcomes which are around well-being, and you could also argue, in terms of the broader HRM literature, a kind of common good mentality which says that HRM policies and practices may be related to the broader well-being of the community, and in this context, the well-being of its most vulnerable and fragile members. So we're looking at different outcomes, and we may be looking at different attitudes and behaviours that need to be supported and developed through HRM practices. So to what extent are HRM policies and practices developing skills and capabilities and attitudes amongst the workforce which allow them to develop and deliver for these most vulnerable and fragile members of the community. So I think it raises some quite interesting theoretical issues of a kind of common good model about how HR policy and practices can feed through to the broader well-being of the community. So I think that's one interesting theoretical contribution. I think another theoretical contribution is the importance, I think, of context in terms of how it influences HR policy and practice. So I think it wouldn't be unfair to say that mainstream HRM scholars have paid relatively limited attention, or not as much attention as they could, to the kind of institutional context in which HR policies and practices are delivered. And I think social care is deeply embedded in a kind of sector system which has certain characteristics. As I've tried to stress, around the low profit margins, around the fragmentation of the sector, around the role of the state, around the role of public service delivery models in terms of affecting what goes on. And I think a literature in social care which is more sensitive to context, or in our terms the system, is also an important contribution. Theoretically, how does that kind of sector context interface with the organisation? I think thirdly, there's again, I think the role of the state in the mainstream HRM literature has been relatively understated, and I think social care is a sector which highlights the role the state can, perhaps should play in regulating the treatment of the workforce, and the implications of the state not intervening to regulate the treatment of workforce. So I think the role of the state is another important theoretical contribution that comes out. And I suppose finally, I think looking at the relationship between worker and service users in social care, it's such a close and intimate relationship. And I think what's also an important feature of the relationship between the worker and the service user in social care is the fact that the workplace in social care is the home. Social care workers are working in people's homes. In some cases, they are literally working in people's homes. So when they come into a person's home and they help them feed and dress and wash, they're working in the home. But even in residential, in nursing homes, those are homes as well. They're manufactured homes, but they're still the service user's home as well. So they're constructed as a home. And I think looking at the home as a workplace raises some quite interesting issues about the interface between the service user and the worker. There's some very interesting issues of privacy which kick in. There are issues about the intimacy of that relationship. It becomes a very intimate relationship between the service user and the worker, which is a bit of a double-edged sword. So the intimacy provides the worker with a lot of intrinsic value from their work. The worker enjoys being intimately related to the service users and providing that kind of support. But the other side of the coin is that becoming so intimately related to the service user can create workplace pressures and tensions and a kind of high level of emotional intensity. So I think there's quite a lot of issues around burnout and stress in social care, which comes from that very intimate relationship that the worker develops with the service user. And I suppose just as the kind of final point, and it's more methodological than a theoretical point, a lot of mainstream HRM literature is quantitative. It looks at the statistical relationship between different variables. I think the texture of employment and work in social care is uncertain, and it's volatile, and it's emotionally charged. And one could argue that quantitative techniques could not fully get to grips with the kind of texture of working life in social care, that maybe qualitative methodologies are much more appropriate and sensitive to that kind of working environment. So I think methodologically also there are some issues that emerge from the nature of work in the social care sector.
Which brings us to the final question. What are the implications of this special issue findings for HR policy or the practice of HR?
I think I'm going right the way back to the title of our special issue, which has the word sustainability there. So I think that there are major challenges for policymakers and practitioners in establishing a sustainable social care workforce, which one can broadly defined as a workforce with the skills and the capabilities to deliver social care on a kind of ongoing and enduring basis. And the pressures for social care are such that sustainability is essential. So the growing needs for social care with an aging population, with increasingly complex needs and chronic conditions, makes the creation of a sustainable social care workforce crucial. At the same time, for policymakers and practitioners, this is quite a complex task to create a sustainable social care workforce. We have seen that there are certain pressures which drive social care providers to converge around quite hard HR policies and practices, which do create problems. There are high levels of turnover among social care workers, despite the fact that they often state, research shows they often really enjoy their jobs. They get a lot of intrinsic value from them, but that doesn't stop them leaving. So there's an issue around how you prevent turnover, you create a more stable workforce. There are also quite significant problems in actually recruiting social care workers. In many developed countries, there are quite high vacancy levels. And that's clearly an issue about the fact that social care work is often low status, it's low paid, and the general treatment of workers is poor. So there's a question about how you can create a sector addressing increasing service needs with high levels of recruitment and retention. I mean, one policy and practical implication sits at the organisation level. So can organisations develop more developmental, supportive HR policies and practices which may attract and retain social care workers? We've said that there are significant systemic pressures which limit their capacity to do that, but some organisations can and do adopt a more developmental and supportive approach to their workforce. So how can they do it? Why can they do it? Why can't others? So there is an issue about social care providers looking to themselves and what they can do. I think, though, some of the kind of systemic features of the sector, the fact that it is fragmented, it's made up of small and medium-sized providers, there's a lack of HR expertise, a lack of HR infrastructure, and the fact that these organisations are too small to actually do it themselves does encourage an interest in the role of the state, whether at a kind of a regional or a national level, and to what extent they can provide that infrastructure. They can provide those minimum terms and conditions to support the social care workforce. And I think that the emergence of integrated care systems at locality level, where health and social care interface and can pool resources to develop this infrastructure, may be an interesting practical implication from this. I think finally, in terms of policymakers and practitioners, I think there is a kind of issue about employee and employer voice, and providing opportunities for employees to meaningfully articulate what they want and how that might be delivered. We know that union membership and representation is very, very low amongst social care workers. We know that many social care workers are actually quite intimidated about expressing their views. They are very precariously positioned in the labour market. Migrant workers who may be on visas are very concerned and sensitive to raising problems that may push back on them when it comes to their visa status. So I think there is an issue about particularly employee voice and how that is made more meaningful as a way of articulating the views of social care workers and maybe supporting the development of more positive, supportive and developmental HR policies and practices. I think finally, I think there's also a very important issue which needs to be touched on, which is about the relationship between health and social care. So increasingly, it is difficult to keep those two areas of service delivery separate. So we have tended in policy and practical terms, and also within the HRM literature, to have an interest in workforce management in healthcare and a separate kind of interest in workforce management in social care. The two areas are becoming increasingly entwined and interconnected. So as people live longer and their social needs become more significant, they also develop clinical conditions which need to be treated by healthcare workers. So I think there's an interesting issue of policy and practice in terms of how health and social care as workforces relate to one another, how they interconnect, how roles and responsibilities, tasks are distributed between health and social care.
So I think that would be all from my side, and I just wanted to thank you very much again for joining me today to talk about this special issue.
Thank you.